Here are 3 questions to better know if you can heal your bone-on-bone knee arthritis. The first question is, can your knee bend enough? And I'll show you how much. The second question is, can your knee straighten out enough? I'll also show you how much I mean. And then the third question is, if there's a loss of motion, has it been more than 3 months? Because the time frame matters quite a bit. So let me get into the first one. Can your knee bend enough? Here's how to quickly measure if you have enough motion in your knee. Take off your shoe, lie down somewhere, put the shoe right behind your butt right here with the toe sticking out. And when you bend your knee, if your knee can touch the tip of the shoe, if your foot can touch the tip of the shoe and your knee can bend enough to do that, then usually you have enough motion in your knee to proceed, even if you've been diagnosed with bone-on-bone knee arthritis. You can do this on each side, and most people will have anywhere from 120 to 140 or even 50 or 60 degrees of motion, but it's hard to measure it on yourself with the tool like they use in the physical therapist clinic. But using this tool, it's proportional to your own size. I know some people have really big feet, some people have really small feet, but the idea here is that your leg should be proportional to your foot size. And so if you can bend that much, then you have pretty good motion and it's workable. You'll be able to use it and improve it if you have a loss of motion. I wouldn't consider that too little motion. The second one is, can your knee straighten out enough? And this one's just a little more challenging to figure out, but you can do it. I'll show you exactly what I mean. So you're gonna have to sit on the edge of a chair somewhere where you have space under your legs, because you're going to have to then straighten out your legs. So take a look down here at my legs. You're going to put your heels out just like this and keep your toes relaxed. It's okay if they're up a little bit. It's not hugely important. Then what you're going to do is put your legs together as close as you can comfortably put them together, and see I have them bent slightly. What you want to do then is forcefully, without hurting anything, just straighten out your knees. And if that knee that is an issue doesn't straighten out enough, then you want to take a measurement, a rough measurement here of where your kneecaps are. And the difference between where this kneecap is, it doesn't want to straighten out, and this one, if it's more than about an inch, so I'll just kind of do that right there, and my finger lines up with this, and that's probably about 2 inches right there. You can go measure your finger against a ruler or use some measuring device. You want to be about an inch different. So right there, if I use that measurement tool, I'm about an inch right there. If you're within an inch of straightening out, so that's about an inch right there, then you have an excellent shot at improving this knee so that you can be fine, not have a knee replacement surgery. You'll be able to gain that motion. But if it's more than an inch, if you're like 2 inches, then it's just you decrease the chances. Doesn't mean that you can't heal and that you have to have surgery. It just means that you're going to have a harder time. So this measurement right here is an easy way to see if you have the capability to improve, if you're in that margin right there. Now, the third one you want to ask yourself is, if you do have a limitation, if you did find that your knees weren't straightened all the way, and it was by too much, more than an inch, or you can't reach your heel to your shoe, then you just have to ask this question next. Has it been like that for more than 3 months? And if you didn't measure yourself, 2 or 3 months ago, then you may not know the answer. You're going to have to go off your best guess. And the 3-month cutoff, it's not a hard and fast rule. I have had many clients that have been stiff and had losses of motion for a year or more and made improvements. It just means that you're going to probably have a harder time. The people that have those small losses of motion and it hasn't been that long, they improve the fastest once they start going through our treatment approach. But if you've had a bigger loss of motion and it's been there for a longer amount of time, doesn't mean that you're going to have a surgery. It just means that maybe you're not going to gain the full range of motion, and possibly it's going to take you much longer. Okay, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it, and it doesn't matter how severe it is, if you've had it
just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program. There's different tiers of this. On the first tier, it's group coaching along with the whole curriculum of 40 plus. I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements. But you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too. And of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program. And I hope to see you in the program on our coaching calls. Healing a bone-on-bone arthritic knee is a process, and simply gaining back lost motion is not going to fix the problem. But what I want you to take away from this video is that it is possible to recover, feel better, and not have a knee joint replacement, even though you have a loss of motion. A lot of people start to equate with, I've been diagnosed with knee arthritis. They told me that it's bone on bone. The bones are touching each other in the knee. And then I also have this limited range of motion, and maybe it's been there for a long time, for months. Even in that situation, you can become pain-free or reduce the pain immensely, increase the mobility, get your lost motion back, get back to walking, get back to doing things. And what I tell people all the time, I mentioned this hugely, this is what my program is focused on, the knee arthritis recovery program, is gaining back your ability to be on your feet, gaining back the motion and the space in your joints by fixing the muscle imbalance so that you're not over compressing the knee joints. Go check out the link in the description below if you want to learn more about the knee arthritis recovery program. But if you want to learn just more tips and advice on how to fix knee arthritis, especially bone-on-bone knee arthritis, I have this playlist right here that's all our bone-on-bone knee arthritis videos.